Let's talk to our next guest, though. This is Dr. Sanjoy Kumar, father of Nottingham attack victim Grace O'Malley Kumar, who suffered at the hands of the schizophrenic killer Valdo Calocane. The NHS has now taken action against the scandal-hit mental health trust in Nottingham, NHS Foundation Trust, Nottinghamshire Healthcare, because of the way that they treated Valdo Calocane and indeed let him out on several occasions into the general population, where of course he ended up murdering some innocent people. Dr. Sanjoy, very good morning to you.
Good morning.
Thank you very much for joining us. This action by the NHS is probably welcome, I suppose, but it's a pity they didn't really do something sooner, really, isn't it?
Mike, I think, as you know, this is a trust that has been failing all the way since probably 2021. And this action, you know, they have been reprimanded time and time again by the Care Quality Commission, but they just haven't improved their standards. Some of the things that have come out of this mental health trust have been horrific in terms of how they treat patients, the access to patients, and when they do eventually treat their patients, how they treat them. Valdo Calocane was sectioned 4 times. That's an unbelievable amount of, you know, times a person can be sectioned. And for him to be sectioned 4 times and for them not to change his treatment is almost bordering on the ridiculous.
Yeah.
You were, in your previous item, you were talking about safety. You know, how can our country be safe internally if you've got people who are just not treated? So you're absolutely spot on when you say that this is a failing trust. And very recently, I've got the letter in my hand, a letter of enforcement has been sent by NHS England to the Mental Health Trust. The language in the long set of the enforcement undertakings, again, so disappointing because it just talks about failings. The primary word here is failings. Failings by the licensee, you know, failings of governance arrangements, failings to establish an effective board, failings to establish and implement systems. The word failure is used here so many times, it's almost ridiculous, again.
And was there no kind of supervision of this trust and the way that it was operating at all then?
Well, they have now appointed someone who's actually going to look after the improvements in the trust. They've appointed an improvement director in this document that they have sent out, and the improvement director is going to be checking on the trust on a monthly basis and holding the trust to account, albeit too late for us. But I just think that, you know, the way this trust is operated for everyone who lives in Nottinghamshire, they should be, and I'm sure are worried that they just do not have a mental health service to speak about that's got any integrity and that's treating patients properly at all.
Right. And was there kind of diagnosis of Calocane in any way sort of relevant to the sentence that he got? Because obviously I know your family and the families of the other victims were also upset about the fact that he's been sectioned rather than sentenced, having pleaded guilty to manslaughter. And I know that there's a possibility at some point in the future that he could get released.
Well, this is it. It just shows, if you look at the data, it shows that people who are actually incarcerated in a hospital get released. The majority of them get released, you know, within 10 to 20 years. Now, for a country that is striving and you know, we are struggling with our internal security, for someone to be released like that into the community, I don't think brings, you know, any kind of security to people who are along with us. And you were talking about robberies, and you know, here we are talking about a multiple murderer who is potentially going to be released. And you're absolutely spot on, Mike. You know, when His Majesty's Inspectorate of CPS did a review of the case, they said that the CPS had got everything absolutely right. What they didn't actually say at the time was that the main expert that they went by had stated that Valdo Calocane had got some sort of a resistant illness. What the CQC and what the Mental Health Trust have told us now in our investigations is that this person didn't have any form of a resistant illness. What he didn't do is just simply not take his medication, and there were no systems in place by the Mental Health Trust to force him to take his medication, or if indeed give him injections which last a month, which he couldn't say no to. But they didn't force him to do that, even though they knew he was violent, and even though they knew that he wasn't taking his treatment. So they got the very, very basics wrong. It wasn't anything complicated. It was basics. And if you look at our case, the catalogue of failures that happened in our case, this man wasn't apprehended by Leicestershire police who didn't even check on him. They didn't do a PNC, a police national computer check. Not police who didn't execute a warrant for 9 months, so he's roaming the streets committing crime. For 9 months they didn't arrest him. The Mental Health Trust who just didn't simply treat him. And then, onwards you go, and you get an expert telling the court that he's got some sort of resistant illness when he doesn't. The whole thing was an absolute shambles. Anyone who's followed our case will know that we have fought for justice, and what we are fighting for now, and we have been promised by the Prime Minister that we will get a judge-led, what we want is a statutory inquiry, so we can bring all these people in front of the inquiry and say, you failed us, Leicestershire police failed us, Nottinghamshire police failed us, the Mental Health Trust failed us, the HMICPS failed us, all of the organisations that we were involved with, they simply all failed us. It wasn't a sliding doors moment. Anything that could have been a failure was a failure. And for the country as a whole, we were talking previously about the NHS failing. The problem is that I think people are fed up with organisations failing. Internal security of a country is the most important thing for all of us. Never mind the rest. It's about how we feel secure day to day. And I can tell you, with people like Valdo Calocane, and if they are being treated the way they are, we are going to have many, many failures. People are found accountable, put in front of a judge and say, I tell you what, you screwed up and you must pay the price for it. And that's what we're after, accountability.
I don't think it's asking too much. I mean, you're absolutely right, because it's astonishing in a way that it doesn't happen more often, the way that these structures seem to be so badly put together. Listen, Dr. Sanjoy, I really appreciate your time. Thank you so much. Dr. Sanjoy Kumar, their father of Nottingham attack victim, Crazy O'Malley Kumar. They're after retribution and at least some kind of accountability from the Health Trust, Nottinghamshire Healthcare NHS Foundation Trust, who got everything wrong and allowed Valdo Calocane to walk the streets of Nottingham, where he was able to kill 2 beautiful young people who were simply walking home from a night out.